here with the ADHD awareness seminar. The issues for women with it. Author of numerous books, including several about women and ADHD, as well as some very well-known books about college students. You might want to look for Understanding Girls with ADHD, or Attention Girls, her book for girls, or Gender Issues in ADHD. All of her books are available on her .com, which is a website for women and college students. Pat's a graduate of Georgetown University Medical School, and she specializes in child development and psychopharmacology. She's a regular columnist in Attitude. We're pleased to have her write frequently for us, and we're very pleased to have her today. Pat will say a few words of introduction, and then I will take your questions. As always with our webinars, we're not offering medical advice here, and we urge you to see your doctor for any specifics related to your own medical situation. Please type your questions into the box on the right of your screen. If you're having problems hearing, it's probably because of a computer or microphone issue, and it's usually best to dial in on the phone to get the best sound. So with that, let me turn it over to Pat for a few words of introduction, and then we'll take some questions. Hello. Green mic button at the top of the box.
There. Now can you hear me? Thank you. I don't know what happened, but my box suddenly went. For hosting these seminars and also for inviting me. This is such an important issue, and I'm thrilled to be able to do it. So often, girls and women have really been the silent sufferers. Teachers are unaware of the disorder. In girls, there have even been studies done showing that the girls do. That very often people mistake it for other things. Or since with this disorder we see that it really affects males with ADHD, it seems to be how they, and it's really an externalizing disorder. And for females, we see that it's really an internalizing disorder, and it's as a consequence, both the girls very smart, that they can't do anything right. They develop a learned hopelessness, helplessness. You know, this always happens to me. It carries on no matter what they are. This low self-esteem continues with them. And we also see quite often that this leads to very perceptive they try very hard to control They may develop perfectionistic qualities. They may also almost look OCD with obsessive compulsive control this because it's going to really affect my life if I don't. They work very hard, but it's not easy. And we would say women with ADD stay in the closet much longer as a result. And stay in there. And
welcome to GoToWebinar, web events made easy.
Let's start with some of the questions that you have.
That's great. You know, to this point of girls just not being diagnosed easily, and I think I've read in something you wrote that girls on average are diagnosed 5 or more years later than boys, even in today's ADD-centered environment. Is that?
Absolutely. The mean age of diagnosis for boys is 7. The mean age for diagnosis for girls is 12, and that's if they're lucky.
If they're lucky, right.
There are a lot of mitigating circumstances. If they're very bright, if they work very hard, if they don't have any behavior disorders to call attention to themselves, they may not get diagnosed until college or later, or not diagnosed at all.
Right. So Caroline, one of our attendees, has written that she she has recently been diagnosed with ADD after she's at age 40. And she said growing up was absolute torture. She recognized the issues with her older daughter and had her tested, and it was a difficult diagnosis because they went through numerous professionals before finding a neuropsychologist who did diagnose it. That person is no longer available, has moved out of town, and she's wondering, she's pretty worried about her younger daughter. She wants to make sure that she's correctly diagnosed, and also is wondering not only how to get her diagnosed, but whether counseling of some kind is beneficial in an ADD girl situation.
Okay, great question, because it has several aspects that we need to talk about. First of all, for kind of run-of-the-mill average ADHD, start with your pediatrician. But that's probably not the case for most girls. Usually there's a lot of other confounding factors that we just talked about. There's a lot of anxiety, there's a lot of depression, there's a lot of other issues. So the first thing I would say is look for a specialist in your area who specializes in treating ADHD. So there may be a pediatrician who that's all they do as part of the practice. Usually child psychiatrists locally have more advanced training in ADHD. One way to find someone in your area, again, who may be a little bit better with girls and women, is to call a local university or medical school or ask for the psychiatry department, children's hospital psychiatry department, psychology department, etc. And the other option is calling a university and speaking to someone in their learning disabled students' offices and say, where do you refer the girls with ADHD that are being diagnosed for the first time at college? Then you'll know who locally is more expert at looking at girls and diagnosing girls with ADHD. So that's one place to start.
That's a great idea.
The other issue is counseling. Counseling is not a treatment for ADHD, but it is a treatment for some of the other issues that we see. Girls with ADHD really start very early with negative scripting. They really do say, I'm stupid, I can't do this, I'm not good at math, and they have this real negative self-talk. And in order to help them reframe that, what we want to do, we found that cognitive behavioral therapy does help with ADHD, particularly in this area. So locally, if you can find someone who engages in cognitive behavioral therapy to help rewrite those scripts, the negative messages, et cetera, that's very important. If your daughter, for example, is anxious or is depressed or has poor self-esteem, talking to a therapist may really help with those issues as well. Not the ADHD, it's not going to help the ADHD per se, but it will help her deal with the fallout, so to speak, because she's had undiagnosed, untreated ADHD. And then the third reason I do recommend counseling for girls is we have found, and Dr. Nadeau and I wrote about it in our book that we wrote with Ellen Littman called Understanding Girls with ADHD. And in that book, we introduced the idea of the toxic mother-daughter dyad. And this is something that we often observe with girls with ADHD and their mothers. And what is the toxic mother-daughter dyad? We found that mothers of girls with ADHD are hypercritical of their daughters, and research has borne that out. And we find also that daughters, for their part, are oppositional with their mothers only. So there's a real negative interaction here. You say white, they say black. You know, they may see you as being critical. You may see them being oppositional. You know, everyone else tells you how lovely and wonderful your daughter is, and she can come over anytime, and she's so much fun, and you go, oh my God, just live with her. Well,
so Pat, you're saying that mothers who also have ADHD are
no, mothers
critical.
who don't have ADHD
are
hypercritical of their daughters. Mothers who have ADHD are a little bit more understanding of what their daughter's going through. But if the mother does not have ADHD and the daughter does, we find that that sets up a very negative interaction. And a therapist, a third party, not the father, a third party can help very early, bring this to the fore, get everyone on the same page, and say, you know, this is not going to continue, this is not going to go on, and how do we deal with it? And that's the third reason why I recommend counseling or seeing a therapist if this is something that you find is going on with your relationship with your daughter.
Well, you know, it's interesting you say that because we have a question here from Nancy who seems to understand her daughter, but says that family members insist that the ADHD child, who, quote, is brilliant and able to tend to tasks that she enjoys, should be able to manage her weight, budget, clutter on her own. So how do I attempt to reframe the relationship for my daughter with her family members, I guess aunts, uncles, grandmother?
Right. Well, what we're talking on is educating, and you know, educating them about what ADHD is, and how when you are able to, when you have passion, you certainly can do that. But things that aren't quite as grab you quite as much, like balancing your checkbook, those are things that are much more difficult for the person with ADHD. If after education, after giving them something to read, and I wouldn't give them a book, because, you know, who wants to sit down and read a book, really? I mean, I've written lots of books. I try to make them short. But, you know, if you're asking Aunt Sally to read a book about ADHD, unless she's really dedicated to your daughter. But if you print out some pages from that book, or print out a chapter from that book, or maybe find some PDFs online that you can give her regarding these issues, she'll read those, and she'll kind of get the message. That's the first step. If after that these individuals are still really negative about her and make comments that make her feel less than or make her feel worse, you know, I would say you can divorce your family just like you can divorce your spouse. And there are people that are so negative in your life that you really need to stay away from them for a while. You know, if you've done the best you can and everyone's trying to, you know, be positive and build her up, and this person is still putting her down all the time, that's not a good atmosphere to be in. And, you know, we try not to go there. So I would set some boundaries about how they will interact, and how, you know, maybe it's fine to go to a movie with Aunt Sarah, but that's about it. You know, don't let her in your bedroom, so to speak, so she can see how funny it is.
So protect your child from these negative relatives if you need to.
Yeah.
Yeah.
Very important. Yeah.
Right. That's certainly the case in my family. I won't go into it, but we do have relatives like that. So here's a question from Linda, who says, I'm still on this question of diagnosis. I have ADHD, and I'm pretty sure my 6-year-old daughter has it also. What age is too young for a diagnosis?
8, that's a great question, and thank you for asking it. Behaviors that we typically see in ADHD are commonly seen in children as part of normal development up until about age 2 or 3. If at 18 you're still acting like a 2-year-old, we know something developmentally has gone wrong. So up to 2, we can't diagnose anyone. We may have even before then. I mean, I've had parents tell me I knew this child was hyperactive in the womb, compared to my other kids, or a baby who never walks, she just runs. And that's a rare case, but we certainly do hear those stories all the time. A colicky baby who is running and risk-taking and climbing out on roofs on top of the dining room table, jumping off and onto the dog at 18 months. We can kind of find that child. But after 3 and 4, there are, again, developmental milestones. And one of the, people forget this, but one of the criteria for the diagnosis is that an individual is exhibiting symptoms that are not appropriate for their developmental level or age. So, if you expect 4-year-olds to do X, Y, or Z, or you expect 5-year-olds to do X, Y, and Z, and this child is not capable of doing that, you have to be suspicious. That's why the American Academy of Pediatrics has changed the age range with which we look at children. They now say that if a child exhibits symptoms between the ages of 4 and 18, they should be evaluated for possible ADHD. So I would say 3s and 4s are not too young. Certainly by 6, we can see things that are really important. Now, we're going to get the more severe children, the more acting out children probably at 3s and 4s, but I'm just going to talk a little bit about girls. What do they look like at 3 and 4? They may not be hyperactive at all, or indeed we do see some, but they may be the girls who are shy and withdrawn. They may be the girls who have temper tantrums at 3 and 4. So we see something is amiss. We're not quite sure what it is, but they are having the daydreamers. I mean, I had one mother who said, my daughter has always been kind of like in her own little world. She would hyper-focus even at 3 and 4. She would play in that sandbox and just get lost in the sand, and, you could call her name. She wouldn't look. She'd just be kind of, and she's going to be doing the same thing at 8 and the same thing at 18. But you can see some of these symptoms early on, and know that this is what is going on with these girls. So as soon as that little voice talks to you, like something's going on here, you should try to get your child assessed, certainly follow up. We always get the advice, wait. I find that waiting usually doesn't help. We usually see more complications in relationship issues. We see more complications in self-esteem. I've had many, many people say to me, well, my daughter's 8. We know she has ADHD. We're not medicating her right now. Everything seems to be okay. She's doing okay in school. I always say, at what cost is she doing okay? And usually the cost would be to her self-esteem and to the relationship with other family members or friends or friendships. Peers, because we usually see that she's doing well because you're spending all your time helping her find her things, not lose her shoes, know where her coat is, do her homework with her, help her with her projects. So you're spending all your time with her. That may be still positive, but there's a lot that can be at risk here as far as self-esteem and interpersonal relationships that may be the cost and the price you're paying for continuing to have her do well without really addressing that it's ADHD.
That's really interesting. Yeah, I think that price to pay is certainly part of the good girl syndrome, trying really hard, doing everything to get, I just want to go back for a second, Pat. Your comment about the hypercritical toxic relationship just sparked a flurry of questions from the webinar attendees.
Good.
I mean, it sounds like, I've not seen this before in discussions that weren't about girls. So maybe people are just really tough on girls' ADD. But here are some of them. What if a hypercritical person is the older sister? You mentioned divorcing the family, but I can't divorce my daughter. What if the negative person is your husband, but your 6-year-old really loves your daddy? There's just a flurry of these questions. Your dad gets really upset at her for spacing out, not doing things quickly. She's always trying to please him, and she falls short. So it sounds like, there's a lot of this toxic criticism within the family, which
and people haven't addressed this. They don't look at it, and this is again the cost. She still may be getting A's in school, but what's going on here? And this is where we need to educate. No, you're not going to divorce her dad. You're not going to divorce her older sister. But this is where they need to read books. They need to understand what's going on. They need to understand the feelings of the person with ADHD. And this is where the therapist can help. You know, having her and Dad go to the therapist for a session together alone, and her say, you know, when Dad says this to me, it really hurts my feelings. You know, it's great. It'll really open communications and being able to talk about feelings and how this is affecting me. And, you know, having Dad then with the therapist say, you know, as long as she's gotten her work done or if she can do this, you know, or now I understand what's going on with the sister. I know a new book came out for girls. We have a book called Attention Girls, and it's for girls from 8 to 12. And it was the first book on girls with ADHD, and it's a great book to read. There's lots of faces of ADHD in that because there are lots of different presentations for girls. And it's a great book for girls, particularly who don't have friends. I remember I got a call from one mom, and she said, my daughter takes that book to bed with her every night because the girls in that book have become her friends.
Wow.
And but there's a new book just out about a little girl going into 4th grade, and it's called Get Ready for Jetty. And I had one of the little girls that I know with ADHD read that book and review it for our newsletter. And I said, well, what else, what do you think about this book, and can you say something else about it? And this little girl said, it's a book that I would want my friends and my sister to read so they know how I'm feeling.
Wow.
So again, getting a book like that the siblings can read so that they know about the feelings. So both Attention Girls and Get Ready for Jetty talk about the feelings that these little girls with ADHD have. And having other people read those books, whether it's the teacher, the dad, the older sister, read those books and understand the pain and suffering inside is significantly important and is as much part of treatment as anything else.
Well, do you think that, I guess, the same sense of suffering is going on for ADHD boys, but somehow it seems to be more clear in girls? Maybe they're so...
Well, you know, it depends on what age. It depends on what age. I would say, I started doing this in 1969. That, you know, I was very young, and it was called minimal brain dysfunction, and then it switched to hyperactivity syndrome. And I started seeing lots of very hyperactive boys. And in the beginning, you know, we weren't seeing girls, and we saw a few very hyperactive little girls, but you know, that wasn't how the disorder was defined. And it wasn't until later when we started looking at this, and I became quite interested, along with Kathleen Nadeau and Sari Solden. Sari Solden was more women than the young girls. But I always said, God bless these boys. We need to give them a medal because they go to school every day. They don't sweat this stuff. You know, they have a project due tomorrow, and they find out that it's due. They still go watch Homer Simpson on TV. The little girl is the one that solicits help. She's the one that says, oh, my gosh, it's due tomorrow. She goes to her mother. She grabs her mother around the neck and says, oh, the project's due tomorrow, and I'm not going to have it, and I'm going to be in trouble, and it's all your fault. So by doing that, she solicits help, and the mother goes out to Kmart and buys whatever she needs and comes back, and they build it or paint it or write it or whatever, or, you know, do the diorama or whatever. And the girl hands it in, and she doesn't have it. I mean, she has it, and no one knows she has ADHD. She forgot everything about it until the night before. The little boy forgot about it, too, but he doesn't even bring it in. And you know what? He goes in. He goes to school. Oh, that was due? Oh, okay, you know. I mean, I once got a call from a mother. She said, my son's, and he was older, too. He wasn't even, you know, 6, 7, 8, 9, 10. He was even older than that. He wasn't quite middle school, but she called me up in tears saying, I just found out that my son is missing 59 math assignments. What do I do? I said, I have no clue, you know. But he was going to math class every day. You know, they show up.
So he just wasn't bothered to the same degree.
They're not bothered by it. They're not perceptive. You know, you ask them about their son, yeah, I don't know. You know, they'll say more the other kids are bothering me than I'm bothering the other kids. I mean, I found when I started asking kids, are you distractible? The little boys, I had to say to them, do other kids bother you when they make noise in class? And they say, oh, yeah, it's really hard for me to get my work done because everybody is making so much noise. And I mean, here this kid, yeah, you know, has terrible distractibility and is making lots of noise and distracting everybody else, but they don't have a sense of that. Girls exquisitely do. And it's very painful for them, and they have a good self-perception very often. You just need to ask them, and they'll tell you.
To this question, continuing this one about homework assignments and getting things done, a question from Mary. How do you handle executive function issues for teenage girls getting started and completing homework? Do you use different strategies for girls with inattentive ADD?
I don't use different strategies for girls with inattentive ADHD, just teens in general to deal with these kinds of issues. They need to learn how to deal with their executive functioning deficits, and the main thing that we want to do with that is set up a structure and set up routines and teach them how to schedule. They need time management is a huge issue. So they need to start learning how to use day timers, schedules, whiteboards, whatever they need to schedule everything that they need to do in their life, including exercise, including eating, including doing their laundry. And that's why my latest books are all for teens it's called On Your Own. We need to start very early. We've really neglected this. You know, parents are very good really early on at getting this, and as experts we've neglected it. You know, psychologists do 3 days of testing, call the parents in, give them the results. The kid never knows what was said. You know, we go through this whole process of diagnosis and treatment, and the child never gets the benefit of this information. And one of the things that I think is extremely, extremely important is helping these teens be able to function on their own, be independent as early as possible. I see college students whose parents know more about their ADHD than the college student does. They have more information about their disorder, the parents do, than the student. Yeah, or even with the learning, I have a learning disability. Well, what is it? I don't know. I have trouble writing, I guess. I get more time on it. Well, why do you get more time on it? I don't know. That's just an accommodation I've always had. You know, it's like, and they're in college. So we really need to start very early. I had a mother call me in tears one August, what precipitated my writing that book, call me in tears in one August, says, my son is going off to college in 1 week, and I am so worried he's not going to get up for his first class and he's not going to take his meds. And I said to her, does he get up on his own now at home, and does he take his meds himself and call for prescriptions and all of that? And she goes, well, no. I said, well, I can tell you he's not going to do it in a week.
Right.
You know, and, you know, I would say, can your teenage daughter call up for her manicure or her haircut? Can she use the phone? Can she use the cell phone? You know, of course they all can. Well, why aren't they calling up for their prescription refills? Why is that your job?
Do you ever find on that topic, does ADHD or ADD kids sometimes avoid the telephone? I think I've observed that, you know, speaking on the phone, or is that a question of inattentive?
That depends. Girls with ADHD, a lot of them text and a lot of them do all of that.
Right.
But girls with ADHD actually sometimes have language formulation issues. What do I mean by that? They have trouble organizing their language. So they have trouble telling people what they want to say. So as a result, we have a lot of slamming doors in houses, you know. I mean, I want to tell you what, but you're not, oh, forget it. And they go, you know, get frustrated and slam the door. In class, they're not able to answer when they're called on. It is a problem for girls, but if you give them enough time, they can organize their language. Also on medication, they tend to have more organized language and more on-target responses. So that's another thing that we sometimes see. So that organizational piece of their brain sometimes does work.
Right.
Most of the time, though, I see girls probably don't talk on phones. Girls with ADHD have a lot of trouble with social skills and peer relationships. So they don't have a lot of friends. So they don't have a lot of friends to talk to on the phone.
Right.
And that's a real issue for them.
There are a number of questions here about that, both for kids and for adults.
Yeah.
How to connect with friends on a deeper level when you don't retain, you know, memory, and you're not good at thinking ahead to plan things, and you just have a hard time with basics of friendship.
Absolutely, it's a huge problem. Girls with combined type ADHD have a lot of trouble, a lot of peer rejection. Because they're not meeting gender norm expectations. They're just rejected almost within 10 minutes of being with a group of other girls with ADHD. Girls who have inattentive type are usually isolated and ignored by other girls. It's hard for them to break into groups. It's hard for them to see the visual clues that are necessary. It's hard for them to have the verbal give and take. It's hard for them to remember. You know, if a group of boys are supposed to be going out, hanging out, going to a baseball game, whatever, and the kid with ADHD forgets to show up on the corner, his friends will come and get him and drag him to the baseball game. For a girl with ADHD, if she's invited out to lunch or shopping with her friends and she forgets, they're not going to invite her again. Not only are they not going to come and get her, they're not going to invite her again. That's why a lot of girls with ADHD, their best friend is a boy.
Right.
Because you don't need all those social niceties to be friends.
That sort of fits with something else someone spoke to here, that her daughter is often criticized by the teachers for being aggressive in class, whereas the boys in the class are wrestling, throwing each other to the ground, and no one says anything.
Right.
She's just wondering if that's a gender bias issue.
It's a gender bias issue. We also see more verbal aggression in girls with ADHD, and by verbal aggression I mean things like, I'm not going to play with you if you don't do this, or you can't be my friend. Even you see this 4, 5, 6, you can't be my friend, or we're not going to be her friend. We don't want to play with her, that kind of thing. So there's a little bit more verbal aggression. Not towards the teacher, not towards adults, but among peers. With some of the combined type girls with ADHD. But friendship is a real issue. You need to work on social skills. You need to help them understand how to join groups, how to remember to do these things, how to deal with, for children with ADHD, I like Kathy Cohen's book, and that's C-A-T-H-I, Cohen, C-O-H-E-N, and her book is called How to Raise Your Child's Social IQ. It has a lot of good, helpful hints for parents working, a lot of scripts, a lot of games and things you can play with your kids to help them be more aware and be able to develop some of these skills. Michelle Novotny's book, obviously, for adults, What Does Everybody Else Know That I Don't Know? On our website, we have a couple of PDFs for social skills for girls and women with ADHD, dealing with, again, some of these issues that we were just talking about. But it's a real problem we need to be aware of and really help them deal with, because girls, I mean, we got talking about this from the phone. They're not talking on the phone because they don't have the friends to talk with on the phone. But I meant physically capable. Well, now some girls can become shy and then they don't want to call on the phone. But that's, again, when they're in college, they're going to have to go, not only do that, they're going to have to decide, who their friends are, how to get money, how to get class, how to go talk to your advisor for this, how to talk to your professors.
Right.
There's a lot of people you're going to have to be talking with. So you need to start practicing that really early. I'd say, if shyness is part of the issue and being a good self-advocate is part of the issue, you need to start that in middle school with your girls with ADHD.
Yeah, that's really good advice. We have a number of people here who are saying, thanks for all the helpful suggestions about our kids, but what about us? We're grown women with ADHD. So turning to that now, here's a question as follows. I work very hard to hide my ADHD in the workplace, and I spend a lot of mental energy doing so. I have to will myself to do the things that come so hard to a person with ADHD, and it's exhausting. I feel that I don't have enough quality energy left for my family. How do I strike a balance between work and home when doing well on the job means using the best of everything you've got to give?
A fantastic question. And the first thought that comes in mind is build in something that you love to do. I would say exercise, but make sure it's something that you love to do to get refilled before you enter into the home at night. So, if it's quiet time, if it's going someplace that you like to do, to sit quietly and meditate, let's have it be positive. Don't go eat a whole bag of Twinkies before you get in the house so you can face it. But, run, do something, go to the gym, do something that will replenish you before you have to go in the house at night. Even if it means hiring a babysitter for an hour and you going for a walk, or having another teen come over from the neighborhood and stay with your kids for an hour before, so that you can go out for a walk, or that you can go out and do this, or that you can go read a book if that's what you want to do. Anything that helps you depressurize, refill, re-energize, whatever that is, that you need to do that before the transition in coming into the house. Your family, you feel guilty. Oh, I've been out all day. How can I have this time for myself? I need to go home and start all the dinner and do all this other stuff. You'll be happy you did. They'll be happy you did. You'll be in a better mood. You'll be better able to carry through on all the things you need. The other thing I want to say about that is, and this is very important, if you're on medication and treating your ADHD, you want to make sure that your physician understands there is no woman in the world who has an 8-hour or 10-hour day. And even if you're on a long-acting preparation of medication that might last 10 hours, you still need to have medication management of your ADHD symptoms throughout the evening into the nighttime. Most women stay up till 2 and 3 every night in order to get everything done. When they are medicated in the evening, they become more efficient and can actually go to bed earlier and can fall asleep when they get into bed because their ADHD symptoms are under control. So you need to make sure you speak with your prescribing physician about making sure your symptoms are not just under medication management during the day when you're at work trying to get all this done, but also in the afternoon and evening and into the nighttime hours. Very important.
So that would be a second dose, an extended release for the day and then a second dose for the evening hours.
Yeah, right.
Yeah, interesting. Okay. Here's a really interesting question from Selena. I've never seen anyone make something so the problems related with ADHD so clear. She says, I have trouble with verbal impulsivity. She says it causes terrible problems with my immediate family and my closest friends. The consequence seems to be that I'm perceived as ultra-critical and judgmental. What happens is that when I notice things that my kids have forgotten to do, I just am after them in a heartbeat, partly because I know that if I don't say it immediately, I'll forget about it, and also just because I'm verbally impulsive, so I don't seem to take the time to figure out what would be a better way to approach it, what would be a better way to motivate them. I just sort of open my mouth and out it comes. Do you have any thoughts for Selena on verbal impulsivity?
I'll give you some thoughts. First of all, you need a sense of humor, and so does your family. And my family once gave me a gilded filter. It was a car filter, and one of my boys bought it, and they spray painted it and all this. And Mom, we've always said you needed a filter. Here is one, and they gave me this filter. And we all laughed, and, because they know that that's what I'm going to do, that I'm just going to say things. And so everyone has a good sense of humor about it. It's not, if I say it, they understand that I'm not saying it because I don't love them. I do love them. It's hard for me not to say it. And then you need to start working on it, though, and you need to work on it by doing whatever you can do to, whether it's writing things down so you don't forget them, whether it's just saying, I don't want to interrupt you. I don't want to be rude. What you're saying is important, but I do have something to say, and if I don't say it, I'll forget it. Do you want me to say it now, or whatever? So you kind of apologized first and said what you're saying is valuable, so you're validating the other person. I think, though, for me, and really helping is, with the verbal impulsivity, is counting, as well as imagining even sometimes that I'm just locking my lips, doing this visual thing of they're locked and I am not going to say anything right now. I am going to let the other person talk. I am not saying anything. It's not always easy. You're still distractible mentally, and you're going every place else in your brain. That's why all those other thoughts are popping in. As far as things that your kids forget and telling them, that kind of thing, I think what you need to do is, again, work on this kind of transferring the responsibility. Not your responsibility. If you've seen they've forgotten something important, telling them about it doesn't really help. But you might say to them, have you checked everything? Are you sure that you have everything you need? Let's go over the list. And let them come down up with the list of what they need for today's school. And if they say, well, it's Tuesday, and they say, what do you have on Tuesdays? Oh, I have gym on Tuesdays. And they say, well, do you have everything? No, I don't have my sneakers. Oh, my God, and then they go upstairs. But you're modeling for them how they're going to go through a way of remembering what they need. Okay, today's Tuesday. What do I need for Tuesday? I need gym. So that mother could have said to their child, do you have your sneakers? You have gym today. Because she saw that they didn't have their sneakers, and the kid hasn't learned a thing. They haven't learned a skill for how to deal with this. She's done what she needed to do as a mother in her responsibility part. She's kind of worked on her impulsively blurting out, go get your sneakers, and they've both been working on one of their weaknesses. She on her kind of being hypercritical or enabling, and just blurting out that becomes an enabling response versus a learning response. But her child has learned skills of how do I remember what I need to remember, and I'm the one who thought of it. So there's a win-win here if we just might need to take a little bit of time to look for it and deal with it. But that's how you're going to deal with some of these issues all the way along. I mean, even saying to your teenagers, well, your friend also has to do their homework every evening. How do they deal with it? And do some problem solving. Don't come up with the solutions. Don't dictate. You can't go outside till you do your homework, kind of thing. Well, all you need to do is get your homework done. How you're going to do it is going to be a way for you to decide how I'm going to take responsibility for this.
That's really interesting. A bunch of questions, Pat, about the relationship between hormones and estrogen and ADHD. So one person said, is there a relationship between estrogen and ADHD? Another person has asked about ADHD symptoms and medication in perimenopause and menopause. And the third person said that after giving birth to her 2 children, she's found that her ADHD medications just don't work the way they did before. So, putting those 3 questions together, what is the relationship, or what have you seen about the relationship between hormonal changes and ADHD symptoms and medication?
Okay, this is such an important issue. I'm so glad they asked the questions, and I'm going to give you as much information as I can. But I'm also going to tell you there is a monograph on our website called Hormonal Fluctuations and Its Effect on ADHD in Women. And you can go on and buy that PDF if you want, and it'll give you lots of information that I'm going to talk about right now. But I have women buy it and give it to their physicians, and because you're on this issue going to have to educate your physician, your treating physician in most instances. Now, there is a relationship between estrogen and dopamine and serotonin. We now know that the brain is a target organ for estrogen, that in males they have the same amount of estrogen every day. Their male hormones are converted by their liver to estrogen, and therefore they have the same brain enhancement every day from the estrogen. That's not the case for females, obviously. And about 30% of dopamine and serotonin release at the synapse in the brain synapses is the result of estrogen enhancement. Now, if you lower brain estrogen levels at certain times of the month or at certain times during a woman's aging process, you are going to lower the amount of dopamine. Therefore, you are going to see worsening ADD symptoms. What are times when you see lowering estrogen? Before your period, the second half of the month, you are going to see worsening ADD symptoms at that time. We call that premenstrual magnification of ADD symptoms. That is something you need to look at. You need to say, okay, do I need more medication at the end of the month that I do in the beginning of the month? We don't have to look at this for boys with ADHD. We certainly do with girls and women with ADHD. Also, just hormones, when they're wildly fluctuating, when you can think of a time as teenagers, when your hormones are just all over the place, ADD symptoms get much worse in your daughters as they're approaching puberty. You probably have experienced all of that, many of you. They may level out again as things get better, but you may see in some girls that things are always a little bit worse, both emotionally, that's the serotonin piece, the depression, the PMS, the irritability. That mood piece is the serotonin piece, that serotonin goes down. And then the attentional piece is the dopamine piece. So we can see that getting worse before their periods. We also see it as women age. The mean age of diagnosis for women is late 30s. Why? If you've made it that far, now your estrogen's falling down and your symptoms are getting worse. So you have more kids, you have more responsibility, all your symptoms and your stressors are outweighing your ability to cope at this point because things are getting worse all over. You have more stressors, your estrogen's falling down. So in your late 30s, early 40s, and perimenopause, because menopause starts about 10 years before you stop menstruating. As your estrogen starts going down, things do start getting worse. And then with menopause, we do see a worsening of ADD symptoms. And we do see a worsening of word retrieval problems, language formulation difficulties, and other cognitive effects of low estrogen levels. So we do see problems in all of these areas as a result. Sometimes people say, oh, my meds don't work as well, as that lady did who said, after my kids, my meds don't work as well. Sometimes that's not that their meds aren't working as well, it's their symptoms are actually worse. So you do need to increase your meds, but sometimes you need to replace your hormones. After a baby, that's another time of relative estrogen deficiency. It's, again, why you don't get your period for a while after you have a baby, particularly if you're breastfeeding. You may see people do better during pregnancy because they have high estrogen levels, but immediately after birth, your estrogen levels, which are quite high during pregnancy, plummet. And you can actually, again, see postpartum depression during that time because of the serotonin plummeting, as well as worsening of ADD symptoms, particularly if you don't breastfeed. But then if you stop breastfeeding, you may see it then. So things do get worse when the estrogen's lower. What do? Well, we increase meds as we need to, and we also think about hormone replacement therapy. We also think about using oral contraceptives. We don't use the combined. We tend to like to use the estrogen alone and then progesterone alone. We also, in GYN, just in general, for women who have difficulty around their periods, they also can, with some of the newer, like seasonal, different things available, you have fewer periods during the year, so you can go down to 4 periods a year. So you don't have to deal with that over time. But that's something you need to talk about with your GYN and your treating prescribing physician, and you need to work out what's best for you. There's lots of pros and cons for hormone replacement therapy. I'm not going to talk about that now, and that's on a very individual basis. You need to know your medical history, you need to know your medical risks, and you need to discuss these with your physician, your gynecologist. But learning how your ADD is being affected by your hormones is your job, and then you need to go in and talk to your GYN and your prescribing physician about these and kind of work together as a team. The natural, the black cohosh, the soy, etc., can relieve the symptoms of menopause, the hot flashes, and etc. They do not deal with the cognitive dysfunction or the increasing ADD symptoms, unfortunately. So you can't use natural. You can use natural estrogen if that's what you decide to do, but you can't use soy or some of these other methods for dealing with menopausal symptoms.
So there is just a follow-up question here about using progesterone alone. I guess is that?
Progesterone alone makes everything worse.
Worse, right.
Progesterone, so you don't want to use, for example, Depo-Provera as a means of contraception, because they make symptoms of ADD much worse, the progesterone. It's unopposed estrogen. When you just have estrogen, makes everything the best.
Right.
That's why a lot of women say, I felt the best when I was pregnant.
Right. Okay. Carrie has asked about sensory issues. She says, I have extreme issues with crowds and social situations. I'm instantly tense, and there's a similar question about walking into a grocery store and feeling overwhelmed by the number of inputs and the things coming at you. How do you manage this kind of problem? And is this an ADHD symptom?
Actually, we see it a lot in girls with ADHD. There's chapters on it in our book, Understanding Girls with ADHD. We see it frequently. It's seen in boys, too, and it's seen in people who don't have ADHD. But we see it frequently in girls with ADHD, also sometimes bedwetting real early on with girls with ADHD. But these sensory issues are real. You need to understand yourself and them. And you need to give yourself a break, and you need to say, there are things that I just can't do. You can certainly work on desensitization with a good occupational therapy program. But some of these things really you need to avoid them in order to keep your central nervous system is just bombarded. And when we have ADHD, and this is with allergies also, or allergic conditions, or even when you're not feeling well because of X, Y, or Z, I always say if you have a brain that has ADHD, it's vulnerable. It's kind of like a house built of playing cards on a card table. Anything that shakes that table is going to disorganize you and just throw you for a loop and knock you down. So whether it's these kind of fluorescent lights, whether it's a large grocery store, whether it's a lot of noise and fans, whether it's a certain, wool, whether it's allergies, being allergic to mold or hay fever, what tree pollen in the spring, there are going to be times where you're going to be your brain is going to be less functional, and you have a vulnerable brain. So you want to remove as many of those as possible. And you want to really try to make sure your allergies under control. You want to make sure, I used to know what the pollen count was in Washington, D.C. in March. I could tell when it got over, 1,000, because all my patients were calling me up and say their medicine's not working anymore.
Wow. Wow.
And, you could tell when the tree pollen was up there just because you started getting calls that people weren't doing as well. They were not as functional. And, you need to understand that. You need to give yourself a break. You need to, during those times, say, I am not going to write my term paper, in March because I'm miserable in March, or I'm not going to do this, or, I'm really not giving, we unfortunately keep barreling through because that's how we've gotten where we've gotten. But you need to give yourself a break because these things are going to happen, and we don't like to be vulnerable. We don't like to think, oh, I can't, kind of get this done or do it. And sometimes that's the best thing because, the product that you produce at this time when things aren't going well. But you need to also talk about it. How do I get this under control? How do I avoid these things? What would be better for me? What would be the important thing? And for the mothers out there of children with ADHD too, again, we're always trying to be mothers first and the person second, and we're saying, I'm going to, as long as my kid's doing okay, it's all right. I'll get my kid's medicine straightened out first, and then I'll get my meds straightened out. Well, we know that your kid's going to do better if we can get your meds straightened out first. And that's how I really got interested in this field of women with ADHD, was really understanding very early on that the mothers of my patients who had ADHD needed to be recognized and treated. Because if I always used to jokingly say, I'm going to give this kid a star chart, but what I really need to do is also give the mother a star chart so she'll remember to do the kid's star chart. And we found that there are problems with parenting and supervision and flexibility and problem solving in mothers who have ADHD in dealing with their kids. And we need to make sure that our ADHD is treated in order to be able to address the ADHD symptoms of our family. So taking time for yourself really will benefit. They always say, if the mother's happy, everyone's happy in the family.
Well,
taking care of your ADHD helps everything.
Here's a great question from Michelle. Boy, do I identify with this. She says, I'm a woman with inattentive ADHD. I was diagnosed at age 40. I'm involved in so many organizations and activities to the point where I am burnout and I'm physically ill every once in a while, but I can't stop. It's almost like an addiction. I'm so stimulated by activities and my children's activities, I don't want to stop. So I need the stimulation.
Been there, done that.
Yeah, really. Who
You
doesn't
know,
identify
last
with
year
that one, right?
after I said, you know, after I wrote 5 books in 2 years, I said, I am never doing that again. You know, again, we crave stimulation, we crave excitement. It really, you know, gets our juices flowing. I mean, the more I have to do, the more I get done. Give me nothing to do and I'll do nothing, you know, that kind of thing. So, you know, but I think that the really important thing is achieving balance and also recharging. Those 2 things are important. You know, again, you can be on as many committees as you want, as long as, you know, you still can take time for yourself. And that's what you have to do. And that's where that big schedule comes in. You know, schedule the time for yourself. You know, when am I going to take time? And if you start doing those kinds of things for yourself, but put them on your schedule, and do those things. And, you know, and there's always these other things. We're always, again, doing things for everybody else. And I mean, I'm right now taking a 4-week course for myself that I never thought I would ever take. It's on feminism and the feminist movement from the 60s to now. Why I'm taking it, it's at a bookstore near here, and it just sounded like fun. I don't usually do those kinds of things. But you know what? That's what we need to do.
Right.
And, you know, instead of doing one more thing, I've carved out for 4 weeks on Wednesdays, 2 hours every Wednesday to go to this course. And it's been fun and stimulating, just as much as doing one more thing over here, you know, that I could do. But we need to do that. That's how we keep going, and that's how we replenish and do it. I'm not saying, you know, I'm not saying cut everything out. I'm not saying, you know, we need to slow down. But it's really important to reassess, but make sure everything fits in your schedule, that you really can, that you have time for what you consider important, whether it's family, whether it's, you know, movie night with your husband, whatever. Start putting that kind of stuff down, and you'll be able to cut out some of this other stuff because you just will be on your calendar.
We're just almost out of time, and really there's so many more great questions. We'll do what we can. But there are a number of questions here by women who were diagnosed relatively late in life, I guess, in their 40s, 50s, and even 60s. And they're saying, you know, what does this mean? Is this a lifelong condition? Can people in their 60s take medication? Any thoughts specifically?
Quick. ADHD is a chronic disorder. It is never cured. It's a lifelong disorder. However, we can learn to manage the symptoms. We can live well despite our ADHD, and we may not need medication if we make ADHD-friendly choices that allow us to function despite our ADHD symptoms. But they really don't go away, particularly the later you're diagnosed. And so we don't cure anyone's ADHD. If you stop taking your meds, it's still there. If you still
there's no outgrowing it.
There's no outgrowing it.
Outgrowing it. Right.
There's no outgrowing it. You know, 40% of the people, 60% of the people who are diagnosed as children continue to have symptoms that affect their functioning. The other 40 probably still have symptoms. They're just not affecting their functioning. Okay? Why isn't it affecting their functioning? Because they learned to manage it. They've made appropriate choices. They're doing things that really are positive for themselves. That's what we're talking about. So what you need to do is to think, okay, I'm diagnosed at 40, 50, 60. This is the start of the rest of my life. What choices, what things can I do? How can I enjoy? I mean, it's a hopeful diagnosis. I mean, now, so from here on, you know, what can we do? As far as meds are concerned, just real quickly, there are cardiac and cardiovascular consequences of the stimulants that may have more of a consequence with cardiovascular disease and high blood pressure and medical issues that adults have. So that would be, you know, those are contraindications. If you've just had a heart attack, you're not going to take your stimulant. So again, health-wise, there are health issues that come in, obviously, the older, but you can, if you're healthy, you don't have high blood pressure, or if your high blood pressure is under control, you don't have serious heart disease or structural heart problems, mitral valve, you know, damage or whatever. You can take and be treated for your ADHD. And I know even Dr. Nadeau is interested in geriatric ADHD treatment now.
Wow, that's really fascinating. Well, we are out of time. This has been so terrific. Everyone on the call, please go to Pat Quinn's site, advance.com. Find references to her books, lots of great articles, and just a lot of terrific information. And, you know, Pat, maybe we can get you back for round 2 when we finish this current schedule of webinars, because lots of great questions here. But thank you so much.
Thank you, and thank you for inviting me, and thank you all for attending. I really enjoyed the questions and being with you this afternoon.
Thanks, everyone.